Yes, good afternoon. We're currently verifying if there is transmission in a certain neighborhoods of Montreal, in Montreal North, for example. The Montreal Public Health Authority is applying a strategy of test and investigation in this zone. I want to be clear. We've announced our reopening plan, but it's not starting this week. Gatherings are still forbidden. It's not the time to stop our efforts of social distancing. It's time to be more disciplined than ever. If we stop our efforts and the situation doesn't improve in Montreal, I won't hesitate to push back the reopening. So I'm counting on you all. Thank you.
Good afternoon. Testing is a key part of the confinement strategy, but we're missing details, like key details, such as where will the testing and analysis be done? Who would do contact tracing, and how serious are you when you say that all this strategy in Montreal, for example, can be scrapped by gatherings?
In fact, when you get gatherings which are, I would say, not permitted, I think it would be more difficult to get the information for where people were infected. If we get a school where there is infection, if we got a workplace where there's infection, it's going to be easier for us to do our enquete and try to have the contact tracing and everything. So I don't know how much people will collaborate and say, I was infected probably in that party inside of this place and everything. So those cases are going to be contaminating others and others. So it's why we want to know where it's open, where people will have probably get the disease if they are not getting in the community. Imagine if we get to analyze all those things. It's why, at the same time, you must understand that the people that we are putting together or in workplaces are low-risk people. I don't ask people with immunocompromised disease to go to work the same way. And the work is going to be different from the way it was before. We will keep the 2 meters distance or have protective equipment. I'm not so sure that in social things in-house, meals together with 2 or 3 families, that it's so not normal to stay 2 meters away when you have a dinner, that probably the risk there is going to be higher, and it's more close contact, more long time together than it's going to be in the workplace.
Second question.
I would like to hear your strategy for Maisonneuve, Douglas, and Lakeshore, starting over again. I'm not quite sure I understood well. And how can you guarantee the hospital system, the situation is under control? I heard you saying it's critical when staff and patients are still moving between hospitals and, hotel rooms now and seniors' homes.
Okay. For those 3 hospitals, Maisonneuve-Rosemont, Douglas, and Lakeshore, we're transferring patients from these hospitals either to hotels, regular hotels like Best Western or what's the name of the other one, the Place du Puy, or at the Hôtel Dieu also that has been reorganized to receive those patients. So that's the first move. It's done. Like, for example, I think at Maisonneuve-Rosemont, it's more than 70 patients that were moving. So it helped the situation. It's not always easy. Maisonneuve-Rosemont is like a cross, so you have in the middle to be careful. We're washing, disinfecting all the place before getting other patients coming in. So we're really putting all the energy to make sure that the situation is under control. And we're confident that in the next few days, at those 3 hospitals, Maisonneuve-Rosemont, Douglas, and Lakeshore, that the situation will become under control.
Thank you.
Is it under control overall in the hospital system? Is
Quickly.
it under control?
But it's tighter when I say that we have 1,600 beds that are used. A good part of that is in Montreal. So we have to be careful. I don't want tomorrow to have 3,000 or 4,000 people hospitalized. So it's not easy. And the margin is tighter in Montreal. So that's why it's very important between now and May the 11th and May the 19th to see the situation under control.
Next question, Samuel Pouliot, CTV.
Hi. Construction of the REM commuter train project is set to resume, and shuttle buses will be used when the Mont-Royal tunnel closes. With the COVID pandemic, how can you ensure the safety of concerned passengers?
Of the passengers?
Yeah.
But we already said that when you use buses, metro, that it's better to wear a mask. If you cannot stay at 2 meters of the other people, it's better that you have a mask. So this is a recommendation of the health, public health.
And with the respect of the $45 million at the CHU Quebec spent for N95 masks that were not delivered, what safeguards are in place to prevent fraud like this kind of purchases, especially when concerns were raised by 2 banks? And why was the purchase authorized without further verification?
First, we have to understand that there was a special situation where everybody in the world were looking for masks. Some vendors, they were looking for money before delivering the goods. But I'm happy to see that the $45 million has been freezed. The court has a permit that we freeze the money, so we're confident that we'll recuperate the $45 million.
Thank you. The next question is from Raquel Fletcher, Global News. It's for Mr. Legault. Opening up the regions and businesses has created confusion among people. Are you going too fast? What are you going to do about all the questions people are now asking?
I think that was the idea when we tabled those plans, was to give the people the time to digest, to understand, to ask questions. So some people, they think that we're reopening tomorrow. It's not the case. It will be done gradually in the next few weeks, first in region, after in Montreal. And if from now and the opening of the different companies or schools, if we see that the situation is not under control, we'll stop all that. So it's really a plan to give the opportunity to all people to put the right conditions in place for the protection of workers and students.
Thank you. And as a second question, the entire education community is nervous and confused. Are we opening schools too quickly?
I don't think so. For sure, in regions, the situation is under control, and there's no reason to believe that the situation will be different in 6 months from now. So, yes, there are some risks. Children have a very low risk of getting bad consequences. So we're doing, and we're putting in the balance also the fact that for a child not going to school for 6 months, it's not good for the child.
Thank you. Now the next question is from Phil Autier, Montreal Gazette, also for you, Mr. Legault. On Wednesday, you said 400 soldiers were on their way to help in aid CHSLDs. Can you tell us how many are actually working today in CHSLDs? Last week, you said the healthcare system was short of a few thousands of workers. What is the status today? How many vacant positions are there to fill?
Okay. Right now, we have 10,500 people that are absent. We have 7,200 people that we've hired and are working now, coming from the website Je Contribue. We have 1,200 students and teachers that are working right now in our system. We have 241 soldiers that are working now in our system, and we are supposed to get 276 more soon. That's all what I have.
Thank you. And now for Mr. Arruda's very last question. Many people are worried about the situation in Montreal North. Can you tell us what you know about the outbreak today? How many people have died there? Is the situation out of control?
Actually, there is a hotspot over there. I know that there is a quantity of people who are, I would say, health workers, around 240. I think that's the number I have, but I need to get more information from the investigation done by Montreal, actually, in that place. Probably that the virus was introduced there through, I would say, through workers working in CHSLDs that were asymptomatic and came back. There is a higher risk of vulnerability in that population because of the socioeconomic level, because of the crowding of the people in families. That's all factors that makes that thing. But actually, people are being taken care. People, outbreaks or families who have cases are investigated to offer them care or understand and make them in quarantine if needed. And there's going to be a specific, I would say, screening done tomorrow and on the next days, specifically in Saint-Michel and around places there. And there is also some issues in some communities in Laval.
Thank you very much. So that's all the time we have.